Is Brazilian butt lift, volume loss due to fat reabsorption common? A Brazilian butt lift is a popular way to enhance the shape and size of the buttocks by using your own fat. But many people wonder if losing some of that volume over time is normal. The answer is yes, it is quite common and expected to some degree. When fat is transferred during the procedure, not all of it survives long-term. Typically, about 30 to 50% of the injected fat is reabsorbed by the body during healing. This means that some initial fullness may decrease over the first few months after surgery. Here's how it works. The procedure involves removing fat from areas like the abdomen, hips, or thighs through liposuction. That fat is then purified and carefully injected into the buttocks to add volume and shape. However, for the fat cells to stay and thrive, they need to develop a new blood supply. This process, called vascularization, takes time. Usually between 3 and 6 months after the procedure, the fat cells that successfully establish blood flow will survive long-term. Those that do not will be broken down and absorbed naturally by the body. Because of this, surgeons often inject more fat than the final desired volume. This accounts for the expected loss and helps ensure the results meet the patient's goals. Factors that influence how much fat survives include the technique used during harvesting and injection, how well the fat is handled, and how closely patients follow post-operative care instructions. For example, avoiding sitting directly on the buttocks for at least 2 weeks helps maximize fat survival. Weight changes after surgery also matter. If a person gains or loses weight, the volume of the fat that survived can change accordingly. Some patients might choose a second procedure if they want to restore volume or correct asymmetry caused by fat reabsorption. In summary, losing some volume due to fat reabsorption after a Brazilian butt lift is normal and expected. Understanding this helps set realistic expectations. Proper surgical technique and careful post-op care are key to achieving the best, long-lasting results. Always consult with a qualified plastic surgeon to discuss your individual situation and goals.